Over 34,000 Kansans call Cowley County home. The county has a diverse population. Although many have been able to lead healthy lifestyles, many others do not have the same circumstances. Various factors play into what gives people access to healthy living. These social determinants of health are important barriers to consider when discussing public health.
We see the result of all of those pressures that are put on individuals, be it economic, educational, disadvantaged by location of residence, and food deserts and islands and things like that. So we deal with it constantly.
Particularly during COVID-19, we saw that there were disparities in access to health care. What we're trying to do is recognize those social determinants when patients come in to see us so that we can act on them quickly and again make healthcare more accessible and more equitable.
Social determinants include like education and their health, economic factors. So therefore, if they start out with having poor education, then it has a domino effect with their economy, with their financial status, and sometimes even their lifestyle choices.
If someone comes in survival mode, they are not going to be open to anything else besides putting that fire out and on to the next problem. A background of generational poverty really informs those reactions.
Some people who are thriving really well and some people who are just surviving. If we can close that gap and get everyone there, I think that would be the healthiest community.
We are very good as a community, from what I can witness in my roles in both healthcare and education, at reacting to people in poverty and their immediate needs. We can rally the troops, we can channel funding, we can come up with campaigns to get people tents or food or whatever they need. But when it comes to the harder work of looking at the underlying root causes of poverty and those real barriers that keep a family stuck in poverty, I feel like I don't hear as much of that happening.
The social determinants of health, as adopted by Healthy People 2030, consist of these 5 domains: access to quality education, economic stability, social and community context, housing and built environment, and access to quality healthcare. These are the conditions where people are born, live, learn, work, and play, and they affect a wide range of health and quality of life outcomes. Head Start is an organization that works with families of poverty in the community.
To qualify for our services, a family of 4 would make under $28,000 in a year. So we have 147 of those slots for students in Cowley County, some in Winfield and some in Ark City. We have no trouble filling those slots each year and have a waiting list. And so it just shows the need of families in our community. Drug abuse, mental illness of parents, families have divorce and death, and all of those things impact us all differently, and those all fall under what we call ACEs, or adverse childhood experiences. But being cognizant of that in the classroom, but also as a community, we need to realize that we have to help support these families in a different way. We have an amazing family services team. That team's biggest goal is to make sure that our families have basic needs met and make sure that they know where their medical and dental homes are. Kids can't learn if they come to school and they have a toothache or they have a medical condition going on. So just making sure that they have access to those services, and then being able to get to those appointments. Transportation is huge within our community, and so they will even transport families to those medical appointments. When we know better, we do better, and so more tools in our toolbox and what we can do to help children from something that's a small sensory need that they have because their socks don't fit right, all the way up to they don't have language yet to tell us what's bothering them or that they're hungry or tired. Through our family service advocates, we're also helping give parents some of those tools. You know, it's not unusual to go into a store with a child and then have a tantrum because there's something that they're needing or wanting, and just having tools in your toolbox to deal with that is a huge relief to parents. As we've researched other early childhood programs and efforts in communities, being able to have all of the services under one roof. So you have somebody from the mental health side, somebody from the community health side, being able to connect with the school partners on a daily basis. You learn so much about each other's work, and you are able to serve families better. And so pooling all of our funding to provide a one-stop shop for families, they don't have to go somewhere different for school and immunizations or mental health services. That would be a dream. If we could pull that off together for our community, that would be special.
For many other residents, language is the biggest barrier they face in trying to access healthy living. Jojo Oliveras works for the county health department and knows these barriers firsthand.
My title is a maternal child and health home visitor. So I typically work with moms who are pregnant who have infants up to a year old. That's what my title states, but that is not what I do. I help everybody and anybody who will take my help. My own personal story, I've been on both sides of the counter of where I work. So I've been that client that needed help. I try to treat all my clients as if, every time I go inside of a home, we're friends. I have to be in that mindset. I don't want to go in there like authority figure. I go in there, I'm your friend, let me teach you something that I know. And I always go back to language barrier because to me, that's one of the biggest problems that we have here in Cowley County, because you can't help somebody that don't understand what you're trying to do. Most of my clients don't get the services that they need because they can't ask for help, or if they do ask for help, they don't really know what they're getting. Like if we give them vaccines and stuff like that, then they call me and say, what did my child just get? Because they don't know. And if they go see the doctor, the kids are sick. We had a client that, her baby wouldn't drink the formula. There was something wrong with the throat. Well, she couldn't even get into the doctor because she didn't know how to explain that to the doctor. Our nurses can't just go to the appointment with them. So who do the doctors have to translate for them? And like I said, if we do services for them, the doctors do services for the clients, they don't even know what they're doing the services for. Nutrition is a big factor as well. I do participate in the WIC program. Now it's to the point where I go to the stores and I help them shop for the WIC foods because one, either they don't know how to do it, they can't read it, because literacy is also another big problem that we have. So they can't read what they need to buy. They don't understand what they need to buy. Even though we have a WIC app, they don't know how to download it. So that's where I come in. I help them download it. I help them read it. I go to the stores and I help them shop. But it's cheaper once they're done with that to buy candy, to buy sugar stuff, to buy carbohydrates. They can't buy the healthy foods. I don't think they know how to buy the healthy foods or even where to start. Sometimes it's a struggle. Sometimes I wish I could just stop and step back and be like, whew, and I can't, because somebody needed me. And I know what it feels like to need somebody, and there's nobody there. I don't ever want anybody to feel like that, ever.
For those who have been in poverty for years, the lack of access to affordable housing, childcare, and a living wage are keeping people trapped in their current circumstances. Eagle Nest is a nonprofit organization started in Winfield in 2000. Its goal is to give hands-on training to women in the community to help them break free from the cycles of poverty.
A lot of the challenges that the individuals that we're working with now are facing is just that accessibility to affordable, like housing, transportation, and childcare. If it's a cycle of poverty and you are relying on some of the social programs, then it's hard to really see a way out of that if you are not seeking or have accessibility to other programs to help you see otherwise. Sometimes that has to do with education. Sometimes that has to do with social and cultural norms and things like that. So it's a lot that goes into why people might not have the information that they need to know. Like you said, they don't know what they don't know. And until they end up in a predicament where they have to say, I don't know what I need, but this is what I don't have. Some things are so duplicated. You can go here for this and you can go there for that, and wherever you land is what they're going to provide you based off of what they are delivering. If we could figure out how to collaborate more, like I said earlier, have more of a holistic approach of helping people and having a continuum of delivery of communication to people, especially for people who are struck in by the cycles of poverty. It is very difficult for one to hear something one time or see something one time to understand that I need to do something different. For instance, someone comes to Eagle Nest, we do make sure we sit down and budget with them, make them do a little bit of that work and have their own buy-in to helping themselves, because we're trying to build that up. I think the cycle of poverty have a lot to do with why people don't reach out for help more often, and why people stay where they are.
The time has come in Cowley County to deeply examine the conditions holding our most daunting challenges in place. It will take upstream thinking to identify the overarching problems occurring that then trickle downstream to affect those most disadvantaged communities. Poverty, housing, childcare, transportation. We must make progress in these areas if we hope to improve the quality of life for residents in our community. This adaptive work requires creativity and new models of thinking. This is a potentially transformational time in which long-standing gaps in our county affecting children and families can be assessed in a new light. By focusing on creative programming, policies, and interventions that take into account social determinants of health, we can reduce health disparities and improve the future well-being for all people.